My name is Dr. Liana Leach and I'm a postdoctoral fellow here at the Centre for Mental Health Research at the Australian National University. What we looked at really was the relationship between unemployment or employment circumstances and people's mental health. And previously what research has shown is that people who are unemployed have worse mental health than people who are employed. But what our study found was that being in any job is not necessarily better than being in no job. We found that job quality was an important factor and that people who were in poor quality jobs had just as bad mental health as people who were unemployed. And if we looked at it over 2 time points, we found that people who moved from unemployment into poor quality jobs actually became more depressed than people who just stayed unemployed over those 2 time points. A bad job in our study was measured by a certain set of, criteria looking at the workplace environment. And these criteria were high job insecurity, so people might have been in casual work or on short-term contracts, in conjunction with a heavy workload or high job demands, and a lack of control, over how they manage these job demands. So they also had very low job control. So it was a combination of these 3 factors together classified a poor quality job. We measured depression and anxiety, and people who were in low quality jobs were about 4 to 5 times more likely to be classified as depressed on the scales that we used than people who were in high quality jobs. Everybody has moments in their jobs where it's difficult and you're not enjoying your workplace, but I guess this is really about improving people's workplace environments so that we can improve their mental health as well. And I think the findings are useful for policymakers who are looking at developing workplace programs. So we know that getting people from unemployment into any job isn't good enough. We really need to try to be getting people into good quality work. And they're also useful findings for employers to know what type of workplace environments will most benefit their workers, and for employees as well to make decisions about their jobs and whether they might like to negotiate some of these aspects of their jobs with their employers to try and make it a good workplace that most benefits their well-being and mental health. I think the recommendations are that for policies that any job's not necessarily better than no job, and around work first policies and employment programs, we need to be looking at getting people into good quality jobs and giving them the skills so that they can move into good quality work. And for employers, I guess it's just it's awareness about these particular factors and being open to negotiate things like job security, workload, and giving people more control over how they manage their workloads. It's not only about poor quality jobs. Some other research that we've done also shows that people who move from unemployment into good quality work, their employment, their mental health improves, quite significantly. So it's not only about, the negative side of poor quality jobs. It's really about moving people into good quality work, and we have evidence to show that if we can do that, we can improve people's mental health.